And our moderator is Jasmine Veliquez. Jasmine, there you are. Excellent. Do you want to take it away?
Sure. Hinche, Chakahajagi, Chagachitsky, Ishte Muskogalgi, Ishte Koskalgi. Hola, bienvenidos. Soy Mexicana, soy Jasmine. So hello and welcome everybody. My name is Jasmine Velasquez. I am from the Muskogee Nation and from the Tiger Clan. I am also Chippewa from Turtle Mountain, and I am also Mexican. So I am going to be your guys' host today. Very exciting. A brief just background and introduction as to who I am. I am currently a Indigenous Health PhD student at the University of North Dakota. My entire background is actually in sports medicine. I am a certified athletic trainer with a primary focus in pediatric athletics. I also am a founding member of the Native Athletic Trainers, with our primary focus of being on providing access to sideline medical care for Indigenous athletes. So we travel to the reservations, we provide sideline care, and we sort of bridge that gap between, getting to a hospital, getting to IHS, what can we do on the scenes to provide that care. So today we are going to be focusing on our student panel, and we have some questions that we would like to sort of address to help you guys sort of be able to help the community a little bit better, and then sort of get some insight into what's going on with our students and how they can help us address some of our issues and experiences that they've dealt with. So I'm going to go ahead and let our panelists give their brief introduction, and we'll just go down the list. As you guys can see, their beautiful pictures there. We'll go ahead and start with Mary. If you can introduce yourself, let us know what school you went to and a little bit about yourself.
Hi. Hey guys. Oki Nixokoax. Nistu Natanaku Mary. Hello, relatives. My name is Mary Rattler Lattiser. I'm enrolled Blackfeet in the Blackfeet tribe of Montana. And then my mother is from Turtle Mountain Band of Chippewa with some French and Scottish descent as well. I'm a registered nurse. I work as a registered nurse HIV case manager within the HIV Centers of Excellence at Phoenix Indian Medical Center. My healthcare career started over 20 years ago. I started at the bottom. I was a file clerk in the billing department. I became a certified medical assistant. I worked in the lab for a long time as a phlebotomist. I obtained my bachelor's of science and nursing. I'm all nervous at Grand Canyon University, and then started on the med surg floor, progressed to float pool. And then through the entire COVID-19 pandemic, I was on the front line in the ER and ICU. And after that settled and the dust cleared, I needed to step away from bedside, and I took a different direction. So I am now enrolled at the University of Minnesota. I was accepted into the Doctor of Nursing practice in health, innovation and leadership. And then this summer I will also start, I'm also enrolled in a master's of public health. I don't know exactly yet what my DNP project is, but it will be centered around gender affirming care for two-spirit, transgender and gender diverse population. And that's me.
That was beautiful. Thank you. All right, we will move on to our next panelist.
Good afternoon. My name is Janaki Walker. I am a student at Sitting Bull College. I am working on my bachelor's of social work. I actually am graduating this Thursday at 2 p.m. And I have a long history of work with tribal communities, tribal families, mental health consultation with families, a lot of human service aspect, case management. My family, we do a lot of activities in the community. So there are different, things that I have done in regards to health education. And so I wanted to be a part of this panel today. Nice to meet you all.
Awesome. Thank you. And congratulations on graduating. That's so exciting.
Thank you.
Hello, everyone. My name is Ispadaki Shell Brown. I am enrolled in the Blackfeet Nation from Browning, Montana. And I just finished my final yesterday, so I'm currently a third-year pharmacy student at the University of Montana here in Missoula. I started my journey in pharmacy about 12 years ago as a pharmacy clerk at the Confederated Salish and Kootenai Tribes Tribal Health Pharmacy. And then I went to SKC to do my pre-pharmacy. And yeah, now I'm in the pharmacy program. I can literally say I've started from the bottom. Now I'm here. And yeah, I've been trying to do a lot of stuff with substance use disorder. I'm part of the pharmacy student program, Operation Substance Use Disorder, and yeah, I really just hope to help make a change in Indigenous health.
Thank you. To our 3 panelists, thank you so much for your time today. Honestly, we are very honored to have you guys here. We greatly appreciate it. So let's get in and move on to our first question. So our first question is, how have you, was there something you need to say? No? All right. All right, so how have you maintained and adjusted your goal setting throughout your academic journey as you've learned more about your desired healthcare? An example of this would be, did you have to pivot your career focus, or did you end up having to take a slightly different path? And if so, what helped guide you in that decision?
I can go first. So yeah, I got into pharmacy school, and right out of I went from tribal college to university to a graduate program. Pretty scary coming just from a tribal college and then seeing all of these other people. The goal is 4 years to become a pharmacist. And the first year of pharmacy school, I didn't do so great. I was scared to reach out to people. Everyone was so supportive. I didn't want to let anyone down. It took me a while to get the hang of a pharmacy program, a professional program. I did have to add on an extra year to my schooling. And I felt so bad, like I let a lot of people down. But at the end of the day, my community, the patients from the pharmacy that I work at, people back home, my culture, my ceremonies, they help me get through this. Mm-hmm. And I just always tell myself, like, the end of the day, I'm going to be a pharmacist.
I can go next. So goal setting, to answer your question, I think the way that I've maintained goal setting throughout my academic journey is I set the goal, and then I lay out the path to get there. And that could be in multiple dimensions. So I just really even if it's with every semester, I look at every single assignment, and I make sure that I allot time for each writing assignment, and I just make sure, and I also keep a pulse, I keep a pulse on what's happening, what's coming in the next semester, what are my requirements, and so that if there are any moves that I need to make. So I'm always really looking ahead, and I really plan seriously, because I'm the matriarch of my family. I have 4 children. I have 2 stepsons. I have 2 grandchildren, and I have a spouse, and I have a job. So I actually plan, I'm pretty ruthless with my planning in school. I plan school first, and then life kind of falls in accordingly. I don't know if that's really the most healthiest way, but that's what I do. Despite all the planning, it doesn't always work out, and there are bumps in the road. And I'll share a little story where I had a pivot. I had this for 2 years. I had this narrative that I was supposed to become a psychiatric nurse practitioner. That's the need, and I need to be that. That's who I am. So I planned. I targeted 2 schools. I planned. I harvested NP, Psych NP mentors, did the whole thing, reference letters, applied for school, and I got cold feet. I got cold feet, and I woke up the next morning and I wrote the School of Nursing at the university, and I wrote that I changed my mind. And I changed my mind, and I went towards leadership, and that is just wild. If anybody who knows me, I'm really shy. You know, I don't see myself as a leader at all. And I did that on purpose. And I chose that program on purpose because it makes me uncomfortable. Public speaking makes me uncomfortable, this whole thing. And so I felt like I needed to challenge myself. So, you know, despite all the planning, I got the interview, and, you know, I was really doubtful, and I had a backup plan just in case, you know, but I got the interview and I got accepted. And so even though I planned, I had a moment of instinct, and my life completely took a different direction.
Okay. So with me, I was actually in the health field at the time. I was working for SAMHSA, which is the Substance Abuse and Mental Health Services Administration. If you aren't familiar, I was a behavioral health aide. And at the time, our mental health consultant had left the program, and she had gone to a different agency. And so at the time, I was the only person who could fulfill that role, of course, with supervision from an LICSW at Brazelton Touchpoint Center. They are actually located within Harvard's Children's Research Hospital. And so at the time, I was also doing research for them on the grant. And so it just kind of made sense to connect the two together and put me in that position. And that's where I had done a mental health consultation with children and families and staff for 2 years on the Standing Rock Sioux tribe. And that was really interesting. And I really enjoyed that job. And when when we were finishing and we're preparing to close out the grant, I was thinking about my long-term career goals. And I'm like, we really need an LICSW here that can work with the children and families. And I'm like, what do I need to do that? And just then, Sitting Bull College had started their Bachelor of Social Work program. They were in the process of getting accredited. And so I had really pulled back from my career. I resigned from my job. Of course, I have a son who's 11 years old. He's on autism spectrum disorder. And I really, for firsthand understood the need for individuals like myself to support him, in the school, in the community. And so then I decided, well, I think I'm just going to start here, and then I could, work my way into the LICSW field after. And so I was able to do that, just knowing that that was my passion. That was something that I really enjoyed doing, that was something that was needed in the grant. Of course, the services could have continued, but at the time I had a Bachelor of Service or Bachelor of Human General Education. I'm sorry, my baby's here with me. Bachelor of General Education. And then I had a 2-year in Human Services, but there was, with the grants, of course, you need to be a licensed social worker. And so I thought, well, this is the time to go back to the drawing board, given that I have this unique situation. I can either, wish that things would be different in Indian country, or I can turn around and make a change. And so I decided to be part of the change. Like I said, I stepped back from working. I went to school. I had my son, into programming and to help him really get a full schedule going. And, it was through my support at the college that I was able to finish with my academic instructors and my peers, and I just, stuck with it. And it was like, for me, it was like the clouds had aligned, because I'm like, well, now that I'm done, I started researching LICSW programs online near me, and the closest I could find was Walla Walla University. And then I looked at the University of North Dakota, but it wasn't specialized in LICSW clinical work. And my field supervisor instructor came to me maybe about a month ago, and she had let me know that this wonderful opportunity was coming to Sitting Bull College where I could pursue that degree. And so for me, this is not just a job, it's actually a passion, and I actually see the need, and I want to be a part of the change.
I love that. I love all of your guys' stories and your backgrounds. I was getting lost in them, just listening. So we're going to move on to two questions, and these two questions are going to look back sort of at like your high school years. The questions are going to be relative to just sort of what type of support did you have coming from a tribal community leading into being into like post-secondary education, or what was the lack of support? Like, what do you wish could have been there? And for this question and then the following question, I want you guys to sort of just think a little bit more inwardly, just because the people that are here listening are going back to our communities to help them. And so these two questions are going to be really beneficial. So what supports did you guys have from your tribal communities leading into that post-secondary education? And then what supports do you wish would have been there?
What support would I have wanted?
Yeah, or what support did you have, or what support would you have wanted?
I think the support that I wish that I had wanted, I think, Mary's word of the day is going to be mentor. I had a lot of stressors inside, inside community. I had a lot of stressors inside within my own family that I didn't have any control of. And so maybe if I would have had like just kind of maybe a mentor through school, or even just somebody and when I say mentor, like, someone that understands either as Indigenous representation, or even someone that understands the barriers, the specific barriers, the specific issues that maybe an Indigenous child may come from. So I'm an adult. And I have, quite a bit of mentors. And so for, little child Mary, K through 12, I really needed mentors. That's where I'm taking that one.
I feel like as a student, I had really struggled on a personal level with childcare. That's something that, we're in a small community on the reservation, and I think that we had at one time had 3, and now we're down to possibly like 2, but I know that they're not fully staffed either. And so that's something that I wish that we were able to have more of. I think that if I had more time, like, availability, because I'm also a mother, that I would be more committed to my studies, maybe be in more academic activities at the school and after hours, but that it really limited my availability, and it still does to this day. My son, like I said, my son is on the spectrum and he requires respite, but given where we're located, that's not an option, just because we cannot find somebody who can pass certain qualifications for that. And so that's something that I wish I would have had. And then one of the things that I've taken upon myself to create is sort of like a mentorship support group. So when I went into the social work program, I was actually in this place where I knew the social workers because I worked in all of the children and family serving programs here on Standing Rock. And so I was able to identify who is a social worker, and I was able to pull them together on social media in a private group, and just have that group there for questions, for support, for chat, or what their thoughts were on different things. And so that's something that I was able to do along the way. Again, it was just like really thinking outside the box, and what do I need, and what is needed as I'm going. And that's exactly what Mary had said, is mentorship, support, people that you can go to for advising. Like I said, my academic support has been really helpful in this entire process, because, if anything came up, I could talk to them. But I also wish that there were more maybe part-time jobs too, because a lot of us are parents and we still have to support our families along the way. And so I understand that not everyone can do what we do, because we have to make sacrifices every day to continue our education. And for me, that meant, not having a job and leaving work, and trying to figure out, my finances along the way. And so that was challenging and remains challenging. I know that we had lost some in our program because they were not able to do that as well.
I feel like I wish I was prepared more. at like the high school level going into college, I didn't feel as prepared. I started college right out of high school. And it probably took me, it wasn't until my third try that I was finally ready. Um, but I didn't know how to study. I didn't know how to take notes. I didn't know how to take a test properly. And even when I got to the university, most of our pharmacy exams are multiple choice, and those are the hardest tests. I didn't think they would be so hard. Um, but just little things like that, I wasn't prepared for that. Um, I didn't know how to manage my time. Now that, like I said, I'm going in my third year, my third pharmacy year, but really I've been here for 4 years. I'm just kind of, getting it down really good, how to take notes, how to reach out for study, um, how to manage my time. I literally have my weekly planner on my desktop, and and so I see it constantly. But I didn't learn that until, you know, 2 years ago. And I didn't realize how helpful those little things are. Um, and just being able to reach out for people. And I think Mary said this, like just having that Indigenous person that you can look up to. Um, they might not even be in the healthcare field, but someone where you can be like, just joke around with almost and be like, hey, like I'm struggling. Like, can you listen to me or whatever? I just I just need more Indigenous people.
No, definitely fair. Trust me, I totally understand. Sitting for a board exam is no joke, and nobody prepared me for that exam. We have some questions, and I'll get to that in a second. I do have a follow-up question for all three of you guys, though. You guys each mentioned this concept of a mentor, and so at the high school level, let's think like, freshman, sophomore, junior, senior year. When it comes to looking for a mentor, what would that look like for you guys? Would that be just an older student? Would it be just another teacher? If you had to describe what that would look like, what would it be?
I don't think that it would be another student. I think it would be maybe like not a student. Not a student, but someone, just someone that helped bridged. And I don't even know what that means as far as like a role. Just someone to kind of help bridge. Also too, and I don't mean to like take over, but I kind of want to circle back to like specific indigenous like family dynamics that aren't really necessarily within our college peers. And I kind of want to speak on the family dynamic and how, Indigenous family structure, it's not linear. You know what I mean? I have a large family and I have adult children, that sometimes come home for a small period of time. I've had my grandchildren with me while my daughter went through like a transitional period, and I have it within my cohort. I, my cohort sisters, they are responsible for like parents, extended relatives, and children as well. And I just want to kind of point that out too, because I noticed that when we go to, amongst our DMP peers, I feel like that's different, and it's an extra stress on the Indigenous student, that's kind of not recognized or even catered to, or maybe some grace towards. I just wanted to throw that in, but back to your question, I don't know if it would be a student. I think just somebody that was an adult that was, kind, and then just bridged, and maybe gave you some tips on academia. I had to take English 101, I think 3 times when I first started my undergrad. I didn't know how to write, so
Yeah.
yeah.
The person that helped me, um, was actually one of my sister's best friends from high school, and he was working at the university. And I remember just seeing him and just being like, oh, Brad, like, I need you. Like, you know what like he knew my background and I didn't have to explain that to him. I just was like, I need you. I don't know how to be successful. And so he was like I think of him as a mentor. Even if it was just that one little thing of like, hey, these are the resources. And he just provided them to me. And I was able to go about and find more resources and more mentors. But he's the one that started it.
For me, I think it was one of my instructors who is Native American. And of course, she's a woman. She was in social work for years herself and worked in many positions with families like myself and had to navigate the system as well, and had to understand that there's a balance between work, school, home, college, and that type of thing. And so it was really nice to have someone who understood the Indigenous perspective. I know I seen a question in the chat where it says, does the mentor have to be Indigenous? And for a Native student like myself, it really, it was really impactful, that work that, that individual did with me on a micro level, because I felt like this person really understood and got where I was coming from, being a part of a tribal community and having an understanding of the systems here.
So that is definitely one of the questions in the group chat. Do you think the mentor needs to be Indigenous? And I know for a lot of people, this is a significant question, especially for us as women in the STEM field. It is hard to come by. It is hard to come by an Indigenous woman who is also in this field who could potentially be a mentor. And I can say from firsthand experience, I've still to this day have yet to have any Indigenous female mentors in sports medicine. I think the first time I was ever exposed to just a room full of other Indigenous people was when I started at the University of North Dakota. And so I have this common theme, and I'm going to jump in and help answer this question. Then you guys feel free to jump in as well, where I don't just need allies, I need accomplices. So if you're going to try to help with impacting Indigenous communities, you need to be very respectful and understanding and willing to learn, and learn from not just like me, but other Indigenous people, as well as like your Indigenous patients. So what do you guys think?
Could you clarify the question?
On Indigenous, do you think the mentor needs to be Indigenous?
Yeah, I do. I really do. Specifically if you're working with tribal communities and it's the worker is tribal, I suppose unless somebody has, some background, understanding of sociology and how that works with the environment. But I think that it's impactful when you have somebody who is from the community, who understands the culture, tradition, values of the people that you're going to work with, because that is going to separate how successful you are in that specific community.
Hi, this is Dr. Laura Williams. How are you doing today? I wanted to answer the question, and it reminds me of a song, Love the One You're With. Yeah. And really, due to our critical shortage of faculty and physicians, American Indian physicians in general, and health providers, you have to depend on non-American Indian mentors to survive. There are allies that are non-Indian. And specifically, Dr. Robert Like has mentored me for over now, 30 years. He is Jewish and he worked on the Zuni Indian Reservation before. So there are physicians on faculty that have done Indian health in their background, and I believe have the cultural appropriate and sensitivity to work with us. So I would have to debate that point, because that's all I had in my entire career, honestly, except from the Association of American Indian Physicians annual meeting, and then sometimes connecting during the year. So we can debate it though.
I don't necessarily, I think it goes back to the point that as long as there's an understanding and Jenna Kate made that point where it was, did they take some sociology? Did they have an understanding of the depth of the community? And I think that's a huge factor, being able to, understand the community in which you're working with, is huge. So Rita, you've had your hand up for a while, so I'm gonna go ahead and let you ask your question.
Okay, thanks. I wanted to go back a little bit. I think the mentoring thing is super important. And I think I run some programs for Native youngsters at NIH. And we have different levels of mentors. So a cultural mentor, which is a little bit what you guys are speaking about, I think, is different than what the last professor was speaking about, of maybe a more professional mentor and people with, the different perspectives, because it can be a different world coming from whatever discipline you're in. I worry a little bit on behalf of some of the mentors that I reach out to for our youngsters, that they're overloaded because there's so few. And there's a mentoring network that NIH oversees, but I do think that it's a lot to be the sort of poster person for some communities, and I worry about that a little bit for the ones, my sort of go-to people. I'm like, I've got a kid for you. I got a kid for you. They need this, that type of thing. But I also wanted to, but I do think it's critically important, but I also wanted to say, when you all were talking about high school and being prepared, test taking, study skills, time management, and mentors in high school, do you think that it's possible that we are not using the right model, and that for how we're educating and promoting education, because it doesn't have a Native lens for sure, but what can we do to try to see that maybe a model that's more appropriate, and you all would know, can be implemented? And I know it's a little bit of walking a line, and I'm not sure how that would work. And I just wanted to put that out there as sort of a thought question that maybe people would have to think about. But I think often that we're doing it wrong. We're using the wrong model for the people that we're trying to teach. And that's one of the reasons we're not progressing as quickly as maybe we possibly could. That's
So I'm gonna say,
Sorry.
sorry. I was gonna say, we're gonna hold on to that thought, because that's actually gonna bring us into one of our questions about education. If anybody else has a question on the mentor aspect, let's go ahead and address those first, and then we'll move on to this next question.
I have a thing on the mentor. So
Yes.
I have a wide variety of diverse mentors. And I always have had. I was part-time reservation, but then I was also part-time city. My mother did move quite a bit, so I had a little bit of everything growing up. And even when I think about it now, my top 4 mentors are African American, Pacific Islander, Caucasian, and Native. And I get a little bit of something different from each mentor. I do always, I can bring it home, and I don't have to say certain things to my Native mentor. There's certain things that can be unsaid, and I don't have to explain a whole lot, but I do rely on all of their expertise within their help, with their help.
All right. We
I
have.
guess when I do think of mentor, yeah, I don't think it needs to be an Indigenous mentor, but maybe who the Indigenous student feels the most comfortable with. For me personally, it's been someone from my actual reservation. And I know not everyone is able to do that. But I do have a mentor that's non-native, and she's wonderful. And but she's interested in what I want, or like what my goal is, and she's helping me get to that goal.
All right, I see we have 3 hands that are up. If one of our raised hands would like to go ahead and ask their question, feel free to unmute.
I am Supriya Koy. I'm one of the breast oncologists at Oklahoma University. I joined the meeting because I'm working on medical education modules for Native American med students. So I wanted to get some more knowledge. That's why I joined the meeting. And I really, when talking to you and listening to you, I really understand that I come from India. So it's like the belief system is similar. You know, we have a big family, like grandparents, and all of us live together. You know, just like Mary has been telling, like the family dynamics is kind of so much similar. You know, like the belief in when you prayed to the sun, moon, earth, wind. It's the same thing that, most of that Indian communities do. So, when you're talking about mentorship, I think that goes in line with some of the cultural beliefs. And again, like not everybody is same. There's some who are more westernized and some who hang on to the roots. It's the same thing in every tribe and every community too. So I think when you're thinking of mentorship, it may be good to get to somebody who understands rather than like be from the same community. Like I think just like Shirley has said, like somebody who understands your goals but who are open to the cultural background because they also have similar cultural backgrounds. That would be helpful to have mentorship from them.
Ja, Melvina McCabe, Shaheen Dokia, Ami Bashachin, Twitter. I'm a physician. I am from the Dene Nation, and I'm also a member of AAIP. Just very quickly speaking to the issue of mentors, and the comment that
Hey,
was
Melvina?
made is, yeah,
Melvina, hold on 1 second. Can everybody else make sure they're muted, please? Because we can't hear Melvina. Thank you. Or Dr. McCabe. Go ahead, Dr. McCabe.
okay, thank you. I'm not going to go over reintroducing myself again. I'm hoping you all heard that. But to the issue of mentors and also the comments that I heard from the panelists that questions were about resources and availability and all this good stuff. And the comment made by the woman previously who said, should we be doing something different? My thought on this is perhaps maybe what we need to do, because to me it's like a systems problem, and I've spoken with AAMC about this before. The way Western medicine looks at things is you come to us and we'll help you. It's not necessarily let's go to you and we'll help you. That's not the approach. That has been my experience all the way until I retired from medicine after 40 years. So my thinking is maybe what we should do, and maybe we can think about this in our breakout groups. Maybe we can start thinking about putting together resources that can be available to our students from K through 12 through college. And by this, I mean actual names of Indian physicians, Indigenous people's physicians, who have done the work, who know the culture, like most AIP members do. They've lived the culture, and provide that to schools, just nationwide. Send that out to all the schools and send it out to their whatever office it is in schools that has this. So that students who are interested in health or in medicine or, dentists or nurses or any allied services, anything, they have those resources right there and they can call and they can, whatever. Now, it might have to be a centralized system where the personal emails and all that stuff isn't available. But I think the way we're doing things is the Western way, and we're trying to decolonize the system. The Western way come to us. Look up on our website and we'll tell, and then we'll help you. I think we should do it the other way around. I think we should say, let's go to you. Let's go to your tribe. Let's go to your tribal college. Let's go to your high school. Let's go to your middle school, wherever it is. And this is how we can help. And and I think this iHeart project is a perfect project to start that. The perfect project. Anyway, just a few comments, but I thought maybe we could think about that in our breakout sessions.
Thank you. And then we have our last hand.
Hi, I just wanted to ask the panelists, what are your thoughts about mentoring that is conducted online, like through Zoom, emails, other digital resources?
I do both. I do online. I do my mentor, my native mentor is based in Minnesota. But best believe this morning, I know she's in Texas and I was speed dialing. So to you know, kind of do a little psychological prep on public speaking. So I think online is fine. That works for me.
I would have to agree. I feel like, especially with younger generations, our Gen Alpha and our Gen Z, online platforms are really convenient for them and they're kind of used to it. So, yeah. All right. You guys ready for our next question? Let's move on. So our next question is actually going to tie in. Oh, look at that. We have a surprise guest, everyone. All right, moving on to our next question. This has a lot to do with the education aspect. So what is a resource program opportunity that you wished currently existed for K through 12 Indigenous students interested in STEM? And there's more to this question, but in terms of what opportunities, what type of resources or support do you think students should have access to, or even programs that are created or not even yet to be created, but what do you think K through 12 Indigenous students need in terms of having access to STEM or wanting to go into this field?
I'll go first. I think that they need to be more exposed to it. I don't know what it looks like in other tribal communities, but I know that specifically in our community that we don't have much STEM activities, and I think it comes back again to maybe resources and people who can teach those kind of things or give that education. And so for me, when we were graduating from high school at Standing Rock School, I know we had the special education department teacher, and that wasn't even her role, but she took it on. And she came to all of the students and had us do like this assessment on what our skills were and what we were interested in and things that we wanted to do. And then based off of that skill set, there was these career choices that you could go into. And I think that was, for me, that was very helpful because I was like, I was confused, you know, as a high school student, transitioning into adulthood. I'm like, what do I even want to do? You know, I wanted to be an X-ray tech at one point. I did work at medical records for some time. You know, I was working with children and families. And so I didn't really know which direction to go. And so having someone in the school that can have these conversations with our youth while they're, you know, while they're young and they're preparing for that transition is really important. And I did want to add that back to the mentorship that I also had a variety of mentors myself, again, working online with Brazelton Touchpoint Center from Boston to here. And I would make trips back and forth and be in person with them as well. But you know, one of my mentors was Haitian and another was Middle Eastern. And then I had one from Boston there. But I honestly, I'll be really honest, and that's the idea of the panel today, is to get this perspective from us as the students, so that way you can take it back with you and implement it. But it was not effective as it what came to be when I had an Indigenous instructor who went through the same career path.
When I was in high school, we had the opportunity to do some job shadowing at our Indian Health Service um, through one of our science classes. And that's where I actually, because I always wanted to be a nurse. And then I got to work in a pharmacy and I got to make diaper rash cream actually. And I fell in love and I was like, I want to be a pharmacist. So that was actually my first it was because of this program where we were able to job shadow. I feel like as Indigenous people, we like to help, um, whether it's education or health fields. And yeah, I do just feel like there needs to be more opportunities um, for people for students to actually see what it's like to be in that field.
Definitely.
So I'm just going to be true to myself in this moment and maybe be a little bit transparent. And just kind of just provide some context. You know, my grandparents on both my mother and my father, both my mother and my father's side were the last generation to forcibly go into boarding school. And I was, you know, was a loved individual by both parents. But I did, when I raised my children, I took extra strength or extra effort, you know, in trying to break, you know, dysfunctional generational trauma cycles. And I did a lot of work, you know, was aware, and I did a lot of self-work as well. Every single time that I have an opportunity of growth, I get it triggers, you know, and I get raging imposter syndrome. I get raging anxiety. And which is very inconvenient, you know, when you're in academia and you're with, you know, when you're up there and you're trying to hang and then you have this like raging, you know, I don't want to say mental health, but it is. And so I had to tap into some resources. I had to tap into therapy. I started learning just to kind of dig in what is that and where is that coming from? And I need to resolve that, because if I want to completely grow with my full potential, then I really need to come to the table and unpack and try to figure out kind of what those things are. And so I had to, I'm tapped into therapy. I'm tapped into ceremony. I am relearning my Blackfeet language. I have a phrase a week, and I walk around the house and the yard and I say that same phrase over and over again. And when I pray in Blackfeet. And so I guess what I want to say is, there needs to be like something tied into not just the mentorship. There needs to be something about roots and culture and that healing. So I went I went on a little tangent there.
No, it's okay. I definitely appreciate your honesty, and it's really brave of you to come to this space and, you know, give us your story and your background and be transparent in that way. Like, I greatly appreciate that. Just because that's real, you know, and it's also a lot of things that our students are currently facing. And it is true, if we don't address the trauma, we can't really start to heal. And so, yeah, definitely appreciate that. I will also throw in my 2 cents into this concept of teaching. So background, aside from sports medicine and, you know, helping host this panel, I am also a high school teacher. I teach 9th through 12th grade, career technical education, sports medicine for a biomedical careers academy. So I think one of the things that would be really beneficial, aside from having, you know, mentors for students, is access to these fields. You know, there are a lot of standards that students have to meet, you know, their A through G standards for education, and career technical biomed programs can actually, you know, fulfill a lot of those graduation requirements. And I think creating access in schools for having elective courses in STEM fields is super beneficial for students. It has been proven to show increase in academics and increase in attendance. From personal experience for career technical education, kids only came to school for my class. Every other day they weren't there, but they would show up, and they were some of the smartest kids I've ever worked with. So I think by incorporating more STEM electives into regular schools could be very, very beneficial. It just gives access. It's, you know, it allows a student to see their future and their potential beyond what their circumstances are telling them. And then addressing culture, making sure that some of the things are culturally relevant. Definitely huge. So again, panelists, I definitely appreciate your transparency in this. It is beneficial for everybody who is listening. So there we go. All right, does anybody have anything to add into this topic, or would you guys like to move on? All right. Oh, there's a hand. Yes. What is your question?
Hi, I'm Walita Ranger, and I work with an undergraduate pathway program, Native American Research Internship out of the University of Utah. I'm wondering, I agree with everything that the panelists said, and this is more of a question for everyone in the chat. I agree of incorporating culture and giving early access to grade school children and high school students of STEM resources. Do you panelists or anyone in the group know about resources or grants available for things like this? Because these are some of the ideas I'm trying to incorporate in my pathway program, but I'm having a hard time. Like, we're a nonprofit funded by 3 NIH grants, so there's not a lot of like outside extra money to supplement what the students are already getting. And so I'm finding that I have to rely on myself coming up with this money to be able to, like pay for cultural activities or give an honorarium to presenters. Do you guys know of anything available out there that maybe program coordinators can help with this? Thank
Hey,
you.
Walida, maybe we should talk about that at our national, in our national breakouts. I think it's an excellent
Okay.
question that we're all facing. Yeah, thank you for that excellent question. Jasmine, want to go back to our students for this part. We're not going to forget that part, Juanita. That's really
Thank you.
important to iHeart. Yep.
All right, back to our panelists. Here we go. So our next few questions are now jumping into, what was it like in like undergraduate and then that, post-secondary education school? Were there any unique challenges that you faced as an Indigenous student outside of the academic coursework? Accessing resources, community support on campus, maintaining work and school. What challenges did you face outside of just regular academics? And then sort of how did you overcome that?
I feel like for my undergrad, even though I was at a tribal college, I had a lot of my instructors kind of like doubting me, like, are you gonna be successful in pharmacy school? And I mean, and these were coming from non-natives, and that was really hard to hear. And makes you wanna, oh, they're educated, they know I'm not gonna make it. But I really had to dig deep. And I grew up with my culture and my ceremonies. And that is literally what I rely on, praying and remembering. There's in Blackfeet, there's this try hard song, and I would sing that to myself. Even to this day, I drive from Pablo to Missoula every day. I sing the try hard song, not to give up, to keep going, to keep trying. Because this degree isn't just for me, it's for the rest of my Indigenous people.
I can't speak to urban areas because I've never been a student, in an urban area or lived in an urban area and tried to navigate those systems. But at a tribal level, I do believe that, we're looking at a big picture here and we're looking at our systems and our curriculum and our teaching staff and our support. End of the day, communication, just really having a solid support system between students and teachers, and even your president of your college or your dean of students, just having that communication, maybe empathy and understanding. I know that we often are there to teach students and tell them when they need something done or when they're not working like we want them to, but when and where do we have that feedback from the students? Like, am I an effective teacher? am I effective in my role, or am I making this harder for my students? And so that's one thing that I would like to see more often. That's something that has been done at Sitting Bull College. And it was very helpful to me because we learned from each other, you know, reciprocity. When you're a teacher, you know, there's pedagogy there, but yes, when you teach, you learn, and when you learn, you also teach. You know, there's different roles in the classroom. There's intersectionality there. There's issues that maybe your student is going through that, you know, is a barrier to their learning, and maybe they can't focus. So just having something as simple as empathy and communication and understanding, you know, not this is the deadline, and you're not ever going to be able to, if you don't make it here tomorrow, you know, and you're not ever going to be able to move forward. When in all actuality, in some of our communities, you know, for me at the time, I was experiencing death within my family, but I didn't want to say that. But luckily, you know, I had someone who was had great communication skills and was able to, you know, open that door and have that really tough conversation with me, and we were able to work something out. And so, end of the day, just really good communication and transparency between people in academia and the students, and not to be like, oh, this is the end all be all say all. Because if we want students to succeed, then we need to show up and be supportive.
So I'm just going to have you rephrase the question. I feel like I jumped the gun, and I probably could have saved my little tapping into some therapy for this moment here. But if you can just specifically rephrase the question.
No, definitely. It was really just what are unique challenges that you faced outside of academic coursework, being like an Indigenous student?
You know, I tap into the resources as much as I can. I kind of want to speak on the financial strain. I kind of want to speak on, and that's universal. I don't know if that was really an Indigenous thing, but for example, I'm trying to hang in there with my fellow DMP HIL cohort, right? And so this program is going to require there's a lot of traveling. You have to be, I live in Phoenix. I go to the University of Minnesota, and so I need to travel and be there for DMP week every single semester at the beginning of the semester. So that's travel, food, and lodging. That is all out of my pocket. In addition to this program, I will be traveling to Cuba, Iceland, and I'll have an immersion at the United Nations in New York. Again, this is all out of my own pocket. And so, so that can affect anybody. But when in terms of, you know, the Indigenous family dynamic, I take care of a lot of people. I case manage at home as much as I case manage at work. And so, I have to downsize, and we are moving. I've got to move. I got to move out of my home, and I'm going to move into a very cute, tiny little apartment because Mama Mary needs to do this program. Mama Mary needs to travel, and so the whole family really takes a sacrifice on that.
No, that's a real struggle, especially being like the matriarch. There's a lot of nuanced aspects that people don't understand that comes along with that.
Mm-hmm.
All right, my panelists, is there anything else you would like to add?
I don't have anything.
Okay, well, on behalf of iHeart, I definitely appreciate you guys taking your time to be here today. You guys are not only resilient, you are educated, and honestly, you are your ancestors' wildest dreams. So thank you so much for being here. We greatly appreciate it.